So Mitapivat has been an exciting development in the sickle cell and thalassemia space. Of course, we all know that it has already been used in pyruvate kinase deficiency, and it has been approved in that in some parts of the world in that disease for those with pyruvate kinase deficiencies due to missense mutations. I think what is really interesting is how drugs can be repurposed for other things, which I think is something which is fascinating. We've seen that a lot during the COVID pandemic, and I think this is a very good example of understanding the pathophysiology and repurposing established drugs for other diseases. So of course, sickle cell patients have full amount of pyruvate kinase in their red cells. However, giving an agent which will increase or boost their pyruvate kinase activity to the extent that there is more ATP being made, there's reduced 2,3-DPG, and which will allow the more energy. It's like almost infusing extra batteries into red cells. Having that extra red cell energy through the excess ATP molecules will allow the red cell to preserve its integrity of its membrane, and also allow the affinity of the hemoglobin to oxygen reduce a little bit, so that there is increase a little bit, so that there is less hypoxia within the red cell and there is less sickling. It is, this Mitapivat drug has then engendered a whole new generation of drugs in the same class, specifically designed for action in sickle cell and thalassemia, looking at the sort of red cell rheology, improving the red cell functioning by increasing the ATP. So we are excited. We feel that, obviously current data supports the sort of long-term safety of this drug in the sickle cell context, although bearing in mind that there is some sort of stochastic off-target action in sort of aromatase inhibition in Mitapivat, which I believe that newer drugs are probably going to avoid that. So that's something which is going to, something to look out for. But other than that, I think, being able to have access to other drugs, which is not hydroxyurea, and perhaps even combination treatment with hydroxyurea and something else that allows better maintenance of the rheology of the red cells, is something that we're really looking forward to hearing more about and being able to use for our patients.